All right, so I want to talk about the benefits of bicycling. So for this instance, we have a stationary bike. It's a semi-recumbent bike, meaning it has a backrest to it to help support your low back versus pedaling down, okay, sitting up with no backrest or support, to now we have the backrest so I can actually have more pushing power with my legs. I have some push against the back, and the back is supported. I prefer these kind of bikes in the clinic particularly because I have patients that have back issues, but they also want to strengthen their legs. So some of the benefits of bicycling is it really helps to not only strengthen your legs, but helps to mobilize your joints, particularly your ankles, knees, and hips. I use it most often, focusing mostly on the knees and the hips, because you get quite a bit of angle differentiation there. Watch how my knee bends to the maximum there and to there. Now, if I want to bend it even further, I just scoot the seat closer. Now I got a lot more bend in that knee. Okay, it doesn't straighten as far, but it does bend more. So I'll bring it back. And usually when you adjust a stationary bike, you want to adjust it so when you're at full extension, you still have a small amount of bend there. Okay, if I go too far back, then that's not good. That's pulling on my back, it's pulling on my leg muscles, so that's too far. So we need to bring it back to a comfortable position where your back is resting squarely and flatly against the backrest. And that's still a little far. There we go. And that's comfortable. You got a little bit of bend. I'm not bottoming out, so that's perfect. So also with the hip, you get a lot more mobility here. People always ask me, what would be better for my hip to get the mobility in it, walking or bicycling? I say bicycling every time, because unless you're marching in place, you don't get a lot of this much bend in your hip if you're walking. You're very minimal. So this is much better, getting a lot more motion and mobility in the hips and knees. And what happens, why does that help your joints? What it does is it helps lubricate them. You have what's called synovial fluid inside of your joints, and that fluid just basically sits stagnant if you're not moving. But when you're moving, that fluid gets squished in and out of the joint through the surfaces. The more motion you have, the more lubrication that joint gets. So remember, motion is lotion. And we want to get that motion going, squishing that synovial fluid through there, lubricating those joints. And as that lubrication goes through those joints, it provides nutrients to the joint surfaces, lubricant and nutrients. So it basically helps those joints become much healthier. And so bicycling works great for that. Also works good for strengthening. If you want to increase the resistance, you're going to get stronger legs. You can also work on endurance. Okay, you just bicycle further and longer. It works as a great warm-up to an exercise, particularly for a lower body exercise. It gets the blood pumping through the muscles, warms them up, as well as cool down. Okay, so you can drop the resistance and bring your heart rate back down. Again, if you've just done a massive leg workout, you need to get that blood pumping and the body temperature kind of working on coming back down so you can cool it down, stretch the muscles. Okay, so there's lots of benefits for stationary bicycling.